Hey everyone, it's Laura here. I'm popping in today because I need your help. If Our Forever Smiles has ever helped you, if you've learned something new, felt less alone, or found hope through this podcast, then I'm asking you to help keep it going. Creating this podcast, sharing stories, and building a space where cleft families feel seen and supported is something that I pour my heart into. But the truth is, I cannot do it alone. If we want to reach more families and provide even more resources, we need your support. So I thought of a creative way to do this. For just $2 a month, you can help ensure this podcast keeps going strong. For $5 a month, you'll unlock exclusive Moms in Real Life content, real unfiltered conversations about motherhood and career and everything in between. And then for $10 a month, you can get everything plus exclusive merch to show your support. If this podcast has helped you and you want to see it grow to help other families that are probably facing the very same challenges that you are facing right now, please consider supporting us today. Every dollar goes toward making a difference for cleft families just like yours. And right now, we'll be using the funds to elevate the show for production. So we'll be able to add more video and just get new equipment. And as soon as this community is established and we're able to do more, we definitely plan to go beyond the scope of just this community. We want to be able to support scholarships for new craniofacial surgeons. We want to be able to support global surgeries and just really spread our efforts to continue to make an impact in our community. I just want to thank you in advance. And I'm just so grateful that you all are able to support me and support this community here. And it's definitely something that I'm really looking forward to. The link is in the show notes. And I just want to do a shameless plug here. The Moms in Real Life podcast is so cool, so candid. And yeah, it's definitely something that you'll want to check out. Thank you all again.
Today's show sponsor is Sienna Dawn Media Integrated Marketing Agency. Sienna Dawn Media is more than just a marketing agency. They're your partners in progress. Their mission is simple: to alleviate marketing bandwidth, allowing creative business owners to focus on what they set out to do: create. Sienna Dawn Media empowers creatives to thrive without the burden of managing their own social media and marketing campaigns. So if you're ready to set sail toward new horizons, let Sienna Dawn Media chart the course and steer your business toward success. Visit siennadawnmedia.com.
Blah, 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 blah.
Welcome to the Our Forever Smiles podcast, a podcast created to support mothers of children who were born with clefts and those who love them. I'm your host, Laura Arroyo, and I'm also a mother of a daughter who was born with a surprise cleft palate. I know the challenges you face every day, whether you have just learned the difficult news of your baby's cleft lip or palate, you're in the midst of pre-op or post-op, or you're an OG cleft mom. This podcast is for you. In a weekly conversation, we will talk about everything from feeding and speech therapy to surgery and school. We'll share tips from guest experts and advocates and even share a little joy in the process. You can listen to Our Forever Smiles wherever you listen to podcasts. Don't forget to subscribe and stay tuned. And we do not intend for you to use information that we share here as medical advice. You may know her by that name, but yes, we have Tess here today. So excited to speak with you today, Tess.
Oh, thank you so much for having me.
And so, wait, are you a medical doctor?
No, not at all. I had no medical background at all. Nothing.
Oh
Yes,
my goodness.
think that I'm a doctor or nurse but I'm not.
Oh, wow. So what do you do?
I do. So I founded Tess Unlimited a little bit over 16 years ago. And I came to Guatemala as a 24-year-old young Dutch girl that wanted to learn Spanish. And then my life totally changed. Yeah, I set up the organization and I work more than full time. I think it's too much to tell you what I do. I do so many things. I handle, of course, Tess Unlimited's Guatemala Instagram. I do fundraising. I prepare our surgical days and weeks that we have. I hug new babies that I see. Um, I am making sure that we have good results. I also report the results and see if I'm very on top of that. And then I do another 12 million things. I don't even know what I'm doing. Every day is different. And yeah.
Yeah, that's so interesting. I have that, like, as you were speaking, I have so many questions. First, I guess the first question I have is like, why Guatemala?
Yeah, I went to Guatemala because I wanted to learn Spanish. I had a little basic of Spanish, and I heard that in Guatemala, first of all, there's not really an accent, and
Mhm.
classes were cheap. And I always wanted to go to Guatemala because I read so much about it. That it's such a beautiful country, and I just wanted to travel around. That was my only goal.
That's so interesting. I don't know if I think you have spoken to Cecilia, right?
Oh,
Um,
yes.
yeah. So I love Cecilia. She actually could have ended up with your same story. She's someone who has,
Really?
traveled quite a
Yeah.
bit and, has, been passionate about the cleft journey, obviously being a cleft affected individual and having a cleft affected child. And so, yeah, there's a lot of parallels there, but yeah, and it's so interesting too, because your accent is, I guess you have a Dutch accent maybe?
Oh,
Is that
yeah.
yeah,
Yeah.
but then it switches to like a Hispanic accent. Yeah, sometimes.
First time for me that I heard that. Normally I hear, oh gosh, you have a Dutch accent. I'm like, okay,
Uh,
thank you.
yeah, no, the Dutch accent is definitely there. But yeah, so I actually am a, Hispanic speaking, person, or Spanish speaking person. But I'm from America. My parents are both Hispanic. My mother is Panamanian, and my father is Puerto Rican. So we grew up speaking Spanish quite a bit. Like that was our household, communication. So I'm familiar with different accents and that sort of thing. And actually, that is like one of the reasons why I was so drawn to your work, because I'm like why, I'm thinking like, why Guatemala? There has to be something magical or special about this place that they have, and don't let me, like, I that they have this person, this angel that has come to, like, serve this community, right? And I can see, like, there's true purpose in that, right? Like, you kind of, like, fell into this. You were just a young person that was trying to explore culture, and so, and then I don't know whether, like, this meeting of someone that has a cleft, or how you stumbled upon this work happened. Do you remember, like, what that moment was and how
Yes.
you got into this work?
I was in school because when I do something, I do it for the full of 1000%. I was having 4 hours a day, Spanish class one on one. And in the afternoons, I was like, I need to do something else. I love to dance. And there is a big salsa scene in Guatemala. So I was like, okay, I can take salsa lessons, but I also wanted to do something. I wanted to give back. And then I heard about a hospital where they were sometimes looking for volunteers. So I paid them a visit, and they had a nutritional center where there were babies from all over Guatemala, very malnourished. They were hospitalized there. And then they had also a kind of orphanage where they have like very disabled kids and women and men. And I started working as a volunteer in the nutritional center. And there were babies, there were, let's say, babies that had CP, there were babies with Down syndrome, there were babies who didn't have any medical condition, but they were just malnourished, and there were babies with clefts. And
Mm,
I don't know why, but I felt I saw them. I remember my first baby, her name is Flory, and I just fell in love. It didn't scare me. It didn't. Like sometimes people say that, like when you have visitors over there, like, "Who I've never seen that," and but I didn't have that. I was like, oh, "Holy cow, those kids are so cute and so sweet." And so I started helping the nurses with feeding because it takes a little longer and
Mhm.
diapers. And because a lot of parents couldn't visit them because they were from far away, my job was cuddling all those babies each day. Not the worst thing in the world to do. And of course, I fell more and more in love with them. Yeah, that's actually how it all started.
And, like, how does Unlimited come about? And is Tess Unlimited it's not the hospital that you're working with. Do you work with multiple hospitals or, like, how does that all work?
So I'm very blessed because I have my own hospital right now. I
Mm.
opened our first hospital 3 years ago. But before that, yes, I worked in all kind of different hospitals all over Guatemala. That's how I started. What I said, I have no medical background. I turned 24 years old. I was so green. I was young, no experience. And I remember that I was a volunteer in that hospital for a couple of months. And then the hospital had a medical mission coming over to do cleft lip and palate. And they asked me to be a volunteer because they needed somebody to speak Spanish. And because I had 4 hours every single day. So my Spanish was quite a little better than it was at the beginning. And I was there all week to help them out. And I don't know what it is, but I saw things that I thought, huh?
Yeah.
Okay. Not really say I can do that better, but I had a lot of questions popping up. Like, for example, they used this radio and they announced that in Guatemala, and then all those families and kids came in one day to this, they call it triage day. And then there were also a lot of babies that were very young, a couple of weeks old, a couple of just very small, too small to have surgery, and also babies who were very low weight. And they were seen and then they were sent back home. And they said, "Oh, come back next year when we are back." And I was like, "But how do you know if that kid gets the right nutrition? And how do you know if how does the family know when the medical people are coming back?" I started having so many questions, and that's actually where I was like, I started first the investigation, like, okay, which organizations are there in Guatemala who do cleft lip and palate at that time, 16 years ago? Are there local surgeons or local hospitals doing cleft lip and palate? And maybe I can help them because I never had the intention to start my own organization. I didn't even know what it was. So, but then I figured out that at that time, I found out there was one local surgeon for the entire country. And I think I found out there were like two mission teams coming in and nothing. There was no follow up. It was just surgery, surgeons coming in, doing the surgery, going out. And then actually, yeah,
Yeah.
he started to figure
That's
it out.
so interesting because 'cause I've heard of that model, I believe, like, before people realize, like, this is a journey,
Yeah.
this is a you need, like, extensive care. It's not just, like, do this surgery and it's all done. It's,
No.
something that you have to a system within the country, and you need more than one, you know?
Yes. But it's still happening this way. This model still exists for most of the teams that, or most of the organizations that go to countries like Guatemala to operate. And first, when I started, you're young and you start somewhere. I had no idea. I started actually with my nutritional program because I was like, if those babies are underweight, they will never be able to get the surgery because it's too risky. So I started first my milk program, very small. And then I started doing surgeries with like teams that contacted me. And in the beginning, you're just starting. And then on your way, you learn so much.
Mhm.
You learn so much. Like you learn how you want to do it, and you learn also very well how you do not want to do it. They always say Dutch people are very straightforward. We say what we think, and that's the way I. So in the beginning, there was some friction with most of the teams that I got from the US. But I always felt since I started until the day of today, somebody needs to be the voice of those children. And I felt that I live here, I've seen it. I also see what that these families and what kind of like how poor they are. If they see a foreigner, they always think that the foreigners are amazing and can do everything. And so I felt that sometimes also I needed to protect them a little bit, like or to educate them. And in many ways, it has been absolutely amazing. And sometimes you have also disagreements with people, which is completely fine. I think that's life.
Yeah, that's so interesting, and oh, what like, I feel like you have such great integrity to share with them, right? Like, not everyone that you see that is perceived to be doing good is actually trying to do good for you. And sometimes it may just be for themselves or for their own ego or their own, like, savior complex. And, yeah, I know that, and I know that well. It happens in the Hispanic community. I feel a lot where families are taken advantage of, and also they just have this idea that these people are gonna come in and save the day, and that they all have good intentions when that's not necessarily always true. And it is heartbreaking, right, to have to share that and be that honest, and also it's difficult to ruffle some feathers too, right? Because 'Cause we're talking about, like, really powerful people in perceived power, or this perceived authoritative person, and I think particularly in the medical field, that happens a lot. Like, if that happens here in the United States where families feel like they can't advocate for themselves, how much more do you think that that's happening in countries where, first of all, the language isn't there's a language barrier, and then second, you're almost feeling like they're doing you a favor, and they are doing good work, right? These children need these surgeries, but it is, that power dynamic that is shifted in that,
Very
and it's a beautiful thing that they have you to be able to mediate that. They can look to you. Do you feel like the families that you see, I'm sure you see this all the time, where they just when they see you, they, like, wanna jump into your arms?
sometimes they do. I always tell them it's not me, it's my entire team. I cannot do it by myself. And I have an amazing local team here in Guatemala. And yes, but of course, because what you said at the beginning, a baby with a cleft, also in Guatemala, it's a whole journey. So it's not only the surgeries, which is, of course, it's important, but nutrition is as important and speech therapy is as important. So we see those kids all the time. We see them growing up, and you get to know the families well. And sometimes we visit the families if we have ever time, or if I have ever time. But yeah, that's something very beautiful about this work. I feel like I don't have my own kids, but I feel I am the mom of over 4,000 cleft kids now. Anna.
Wow.
And I still get home at night and close the door and have not crying babies around me, which is perfect.
You get to enjoy the good parts, right? The
Yes, almost like a grandmother, right?
Yeah. Yes, that's so true. And so how do you find your doctors for your facility? Do you bring people in and you train them, or do you have people come in, work, and then go out? Like, how does that system work for your hospital?
So in the beginning, when I started, I had a couple of organizations reached out to me, and I started working with them. And I have worked with organizations, and then we said goodbye to each other for reasons. But there are also organizations and surgeons I work with for the past 15 years. For me, it's not so much about the organization. For me, it's about the surgeon who is coming. Is it somebody that does clefts back home? Is it somebody that also does clefts back in Canada or in the United States, not only on missions? Is it somebody that has a lot of
Mm,
experience, that does clefts on a regular basis, that has good results? The moment I'm very picky because I feel that we're talking about clefts, which is in your face. It's for the rest of for your life. And I know things happen also with us. Sometimes you do have an infection, especially in this country where hygienic is very but and sometimes you have a palate that opens up or whatsoever. I'm not going to tell anybody that we are perfect because we are not. But yes, I will absolutely look for the best from the best. It's not so much that I am always looking for new ones, because the moment that I feel that somebody is very capable and very good, and that person feels very devoted to come to us, and there is a match, you're in and you can come wherever you want and multiple times a year. I prefer actually to work with the same people as much. And then sometimes, of course, new people coming in, like younger people, which is completely fine. And then, of course, a couple of years ago, my dream was always to have local people. Canada has amazing medical people, but there's nothing for cleft lip and palates. There is not like you go to you study medicine and then you're going to specialize. Like you cannot even specialize in Guatemala in plastics. It doesn't exist in the university. So if you want to become a plastic surgeon, you have to move to, for example, Mexico and do your plastics there. Nobody there is no program of cleft lip and palate, but because I was already working with surgeons for such a long time, I finally, about 3-4 years ago, I found a couple of surgeons that are plastic or maxillofacial surgeons that they did their whole career or their whole thing in university medicine. And we started training them in
Mhm.
and it takes a while. I was also like, okay, we take our time. We're not going to rush anything. If you rush things, it's not always for the best. And I cannot wait. But next month, we are going to do our first 2 days, 2 operating rooms, full with only locals, with our 3 local surgeons, local anesthesia. And I can't wait. They are now fully trained in cleft palates. And this year they're going to start getting their training for cleft lip as well. And it took 2-3 years to get them trained for cleft palates, which
Mhm.
they're doing an amazing job. Yeah, I'm very excited that we actually finally can start with like with their own people.
Yeah, for sure, and I can't imagine what that does for the people of Guatemala, right? Like, you're talking to a surgeon that speaks your language, that knows your culture, knows, how you raise your children, how you feed your children, how, all of these things that, while we're so spoiled in the United States, it's nauseating sometimes, but it's we don't realize that these things are blessings, that we're so privileged to have, right? That someone actually understands the way of life, that we're talking to a surgeon that understands us. And although even that doesn't matter sometimes, but it's one of those things where you're talking to a doctor that speaks your language and is a part of your culture. And that's an amazing like blessing. I don't know, I'm sure you have heard of like the ACPA.
Yes, I do.
Yeah. So they are an organization that I hope to work with as well, but they have one of the things that is really important to them is that they highlight surgical teams that operate on clefts, not just on the weekends, not just when they feel like it, but that is like their specialty, craniofacial cleft teams. And so I think that is one of the things that's so important. I know with my daughter specifically, there were so many things that I didn't have much information about, and I wouldn't have wanted someone to operate on my daughter that didn't have the hours, right? Like, that wasn't doing this every single time they're in the operating room, whether it's cleft lip, cleft palate, or any other like craniofacial anomaly. I would want the best of the best, right, in this. And so what an incredible thing that you're able to do that as well. Also, I was thinking about this. How do families know about you, and how do they get to the facility? Because you're the only facility of its kind in the country, right?
I do think that we are right now the only organization with our own hospital and who provides the most comprehensive cleft team. There is a local surgeon who has his own hospital too, but they don't offer all their comprehensive parts. And also people have to pay for it because, of course, it's a private clinic. And then you have also like organizations that work only like with mission teams, just like what I said, doctors like doing the surgeries and go out. But from what I know, they don't offer like speech therapy or orthodontics or psychological guidance or ENT, like all the things that you really need for a cleft journey.
Yeah. So how do parents find out about your facility? I think I was told at one point, this isn't in Guatemala, but somewhere in another country, that they like put up a poster that's, and I see them online too. They'll put a poster, say, "Hey, we're doing cleft surgeries. Be here this day, this time." And then there's a mile-long line of people like waiting to be seen. What
Yeah.
is that intake process like?
No, I don't work that way because, and I don't agree with that way because the problem is of how I feel it. All cleft kids need to get prepared for surgery. It's not, oh, you show up and an hour later or next day you're in the OR, in the operating room. I don't believe in that because especially in Guatemala, a lot of children have a very low hemoglobin. So
Mm,
they need first the right zinc and vitamins. Then you have a lot of children that are underweight because
mm,
malnourishment in Guatemala is very high. And also, some kids, or almost everybody, they have very bad teeth, which is also a risk for infection when they need a cleft palate surgery. And to just literally throw them in an OR and do it, in my opinion, that's risky. I prefer, so what we do when we started, we set up relationships. So with all the national hospitals, with midwives, with other organizations. So the moment a baby gets born, they get automatically referred to us. We always hope for that the baby comes in as young as possible, a day, 2 days old. We just had a baby downstairs who was 7 days old, which is great because you can educate the people, their parents, about clefts, first of all, because 99.9% of our parents do not know during the pregnancy that they will get a baby with a cleft. So there's always this mom overwhelmed, feeling guilty. They think it's their fault. So that's why immediately our psychologist comes in action. She talks with the parents. We can explain feeding. We can provide special feeding bottles. If she can breastfeed, we will provide them with formula milk because most of the parents are not able to afford that. So we will make sure the baby will not get more malnourished. Or when a baby comes in very malnourished, we immediately make sure to get them as chubby as possible. And we get them on vitamins and zinc. So we prepare them months before until
mm.
they are ready. They have the right age, the right weight, the right hemoglobin, everything right. And then we program them for the surgery. And that's why our complication rate is super low. I super firmly believe that is because we prepare those children very well. And it's great if you have relationships. We have a lot of relationships within Guatemala, and sometimes it changes when the government change, when the president change, and everybody gets fired. Then all new people that we have, that's every 4 years, and then we have to make a round trip again with our health promoters, telling them like, okay, this is what we do. But most of the time, yeah, we don't have posters or whatever. What we do is we do have evaluations where we go 3 times a year to the rural areas to
Mm.
see our patients. And because sometimes parents will lose their phone or will change the phone number and then forget to tell us. So then we make a little publication, which we publicate in different areas where we say, hey, we are coming that day. It's not for surgeries or whatsoever, but we want to see your child. And then we update all the information and then we enter them in our program again. And then we go on with the follow up and everything they need.
Yeah, so you get, most of the time you get people that do come back, or they respond to that. Like
We have
like
about a 95% comeback rates with our patients.
You said 85?
95.
95. Wow. Has there ever been someone, this is interesting. Has there ever been someone that you've seen as a baby and then they just came back like years later and you're like, we've been looking for you?
Yes, yes, it happens. Yes, recently it was a baby boy. He was in our meal program. We fixed his lip, and then we started calling him for the palate surgery, and phone number was not working, and we tried contacted a social worker, and she said, like, we went to visit the house because that's what we do too if we can't contact them, and it's like, mom moved away, we have no idea. 13 years later, they knocked last year on our door in the hospital, and I immediately recognized him. I was like, oh, you're Elise. And then the mom was even like, and he still had his left palate open. 13 years.
Well,
Hello. I mean, come on. There is lately Facebook or whatsoever. And of course, tragic happened in their family. Dad left the whole family. Mom had to move. Of course, it was not a priority at that time. And so we got him immediately in the dental chair. We immediately got his teeth better, and he had his palate surgery a month later. And he's now in our speech program and is getting braces for the first time in his life this year. That happened. Yes.
yeah, that's so interesting. I think so that brings up a good thing. I remember I was talking to a doctor. He's actually a surgeon at Colorado Children's, at one of the states here. And he mentioned to me that sometimes in other countries they do palate first and then they do lip because of that reason. Like some family, they will prioritize the lip because it's a visual, right? Like you can see it. And then they say, oh, they're all fixed up. And so they won't come back for palate. So if you do palate first, then they'll still have the lip and then they'll be more inclined to come back. So I thought that strategy, right, was like something that I guess wise to do. It depends on, I think, just speaking about this particular patient that you had, what was like the impact on his speech since not having it closed and developing his speech with no palate?
Yes. So he was in school. That was great, but he had a lot of problems because teachers couldn't understand him. He had friends, but many times they couldn't understand him. And we know also that when you get your palate fixed when you're so much older, it's sometimes even very difficult to get them on a normal speech. But 13, we already thought we'd give it a try, and his speech improved so much. I'm not going to lie. I think he will be nasal
Mhm.
always a little bit, but his speech improved already so much with the surgery and the months of speech therapy that he got, that at least people understand him so much better. And he's just another boy. We just did an interview with him this week, and he's so happy. He came in last year as this shy, and now he is already talking and walking around. He owns my hospital.
I love that. So
Yeah.
do the families stay with you? I know I have seen on your Instagram, like you mentioned like maybe there's an area that the families can stay so that you can monitor them over time.
Yes. If you're talking about him, he lives about 1.5 hours from our hospital. So he comes,
Mhm.
they just travel twice a month to our hospital and see our speech pathologist who works in our hospital. And when we, for example, do surgeries in our hospital, we cover entire Guatemala. So we build a patient home, and it's about a 5-minute walk from the hospital. And we have 35 beds, 16 bedrooms. So the people from very far away, they can stay there. They always come before the surgery, stay during, and also a couple of days after before they go home. And then, of course, Guatemala, although it's a very small country, distances are very big. For example, we have 11 speech therapists that cover almost 85% now of Guatemala. So when you're born in the north of Guatemala, which can be 16 hours by bus to come to our hospital, of course, we are not going to tell the parents, oh, you have speech therapy twice a month and you have to travel six. No, we don't do that. So we trained a speech pathologist that goes to that area twice a
Mm.
month. He sees all the kids from that specific state, let's say. And that's how we have them. So the parents still have to travel, of course. So does the therapist. But these are not like hours that parents won't say, I'm not doing it, or it's
Mm.
reasonable.
Yeah. I was gonna go back to something that you mentioned as well. Like when they finally do come into the hospital and we're talking maybe 7 days. You said you had a baby that was as young as 7 days. What do mothers do between that time? I know like for me, my daughter was a surprise as well. So I was like many of these mothers as well, was behind the eight ball. I have the resources here, but I didn't have any idea about what this was. I didn't have a single bottle, and my daughter ended up in the NICU, and that was within the span of what, like 24 hours of me having her because she was dehydrated. And so what do they do within the span of days before they get to you in terms of like feeding and stuff?
It's very different.
Mm,
So I have seen so many things. You will have literally babies that are crying and so dehydrated coming in that you're like, okay, we have to prepare a bottle right now.
mhm,
Parents give feeding with spoons, feeding with normal bottles, although it's not working. We have hospitals reaching out with kids that have a feeding tube and they want us to come to the hospital and bring them a special feeding bottle, which we do a lot. And then tell the mom already how to use it. And then the baby can leave the hospital. Yeah, I have seen moms that use syringes.
mhm,
They fill it up with their breast milk and they feeding like this. That is also one of the reasons why normally our kids, when they come in, they are already low weight because they haven't had enough food. And in most of the hospitals here, there are no NICUs whatsoever. Yeah. And sadly, sometimes we are too late as well. That happens as well. Oh, you just try. That's why we work with one specific hospital. We have such a great agreement, and I wish we could have it with all the hospitals, but it's very difficult. Baby is born, we immediately get a phone call, and the moment that we have special feeding bottles there. We have nurses trained in that hospital. We have a pediatrician. Our pediatrician works there too, so she's fully trained. They will get the bottle. They put the mom in a tuk-tuk, which are like those like motorcycle things. They brought to our hospital immediately. They're not going home before they see us.
mm.
And we open a chart with all their information. We do weigh and measure them again. We see if the moms understands how to use the bottle. And if we see that everything goes really fine, then we schedule them again a week later.
What's the criteria that the baby has to meet in order to have their first surgery? Like we have what's called like the rule of 10. So 10 pounds, 10 weeks, 10 hemoglobin. Do you have that same criteria or is it different?
Yes, we don't like the tens here because it's so on the border. Of course, we started with that, but now we have minimal 11 pounds. They have to be at least 4 months old for a unilateral lip, and we do 5, 6 months for a bilateral lip. And hemoglobin is at least 11.
Mhm.
Yeah,
Yeah.
because also I have to say we barely can do kids who are 3 months old because they mostly never have their weight.
Yeah, I see.
So we have it up a little bit. And also because we are waiting a little bit more, the complication rate in comparison from what we did before went also down.
Mm, gotcha. Yeah. And so you've shared like there's bottles, speech pathologists, hospital, you have beds, like all of this requires like where do you get, your funding from to have these amazing people come in and all of these supplies? How are you funded?
So most of my donations are still coming in from the Netherlands because, of course, I started there, I registered there. We get very, I can say that we actually don't get any help in Guatemala, sadly. And since last year, we are finally registered in the United States. So we can now receive donations from the States too. And we are also registered in Canada. We do we have it a little bit spread now. And we work also together with Smile Train, which is, I think, in your group, everybody will know Smile Train is one of, I think it's the biggest cleft organization. And what I really like about Smile Train is that they have a little bit the same vision as us, that I would like to work as much with local people as
Mm-hmm.
they, for example, they provided all our training for our speech pathologists, because there are no speech pathologists trained in cleft lip and palate in Guatemala. It doesn't exist. So we had to figure out and make our own training and find our own people. And I came up with the idea to train parents of children. And that's what we did. So almost all our speech team, our 11 people, they're almost all parents that have at least one child with a cleft lip and palate. Because I thought, first of all, they have so much experience. They know that you have to be patient, and we help them all with the whole process. We've really selected them. And yeah, I have people that are 12 years working with us, that I met 12 years ago. They had a small baby, and now their kids are in our orthodontic program, and they provide speech therapy to 100 kids every single month. It's their job, which is that's very beautiful. I really feel that is one of the most beautiful things that we have set up within Tess Unlimited.
Yeah, I mean, communication that's one of the major things that I was concerned about with my daughter is communicating, right? Like being able to communicate, because I think also there's a bias that comes in when just by the way that someone communicates, right? If it's not clear, or if they even having an accent, right? People have this idea about who you are before you even before they even get to know you. And so I was very adamant about her communication and just really wanting to. I think that was one of the big things that worried me and that caused a lot of anxiety in me regarding her journey. Do they speak another dialect in Guatemala too?
We have 22 different Maya languages. So we have speech therapists that give speech in their own Maya language too.
Mm.
Yeah.
Wow. And you know some of them, right? Some of the Maya languages?
I tried during COVID. I was like, oh, I
Uh-huh.
have time. Let's try. Holy cow. Difficult. It's so difficult. I can now say I tried, maybe remember words, and that's it. And sometimes I say a word to a mom or whatever, and then and I'm like, no.
That's so funny. I saw a video of you and I'm like, well, that's not Spanish. It must be another dialect. And it's so interesting though, but I know what you mean. You- I know what you mean because there's no rules, I feel like in the language, there's no, because you have a language and then
That-
there's rules that you.
yeah, it's learning Dutch. It doesn't make sense. There are rules, then don't even start to learn Dutch. And I had that a little bit with the Maya languages too.
Wow. Wow. That's beautiful. What do you wish that people knew about children that were born with a cleft lip or palate?
Um, I don't really, I know very much how people think about cleft lip and palate in Guatemala. So I always tell my parents, I said, like, your child is completely normal. There is nothing different about your child than his sister or whatsoever. The only thing they have is they have their lip is open, their palate is open, but there is a solution for it, and we are going to help you every step on the way. But your child can talk, can make friends in future. I said, can have a boyfriend or a girlfriend, even you don't want to think about that right now, can kiss and can go to university, whatever they want, ever dreams they have, they can make it happen. And I always feel like I repeat that so many times, and it's true. Because sometimes, especially in Guatemala, they think it's like a super disability, and that they can do anything in their life. I don't know how people think in the States or in the Netherlands because I am always here. But that is really what a lot of parents think, that sometimes they also think it affected their brain. And I'm like, no, their brain is, I always tell them, I think they're more intelligent than normal people because they figure out how they can drink with everything complete open. They figure it out. And yeah, I always see that they're calmed down a little bit with that when I tell them.
You know, like, I thought that too. Like, I've always thought that too, and of course, I'm gonna think that my child is, like, the best daughter in the whole entire world, but it was fascinating to watch her catch on to the feeding, and she learns things, like, not just when she was a baby, like, learning how to use the bottle, she got it in a day, and then, like, with everything else that I've been able to, like, teach her and show her, she will get it so quickly. She grasps ideas and just concepts and the way that we're supposed to, like, do things, like, it's so easy for her to learn things, and I'm like, "Wow, I wonder if, like, all babies are like this or whether I'm just, like, I it's just my baby or she was just able to adapt and adjust to things very quickly, and I always say she has been resilient in her journey. She's only 2, and she's taught me so much, and she's taught me so much about resilience and just and really that everything will be okay. In closing, I know we talk about, like, what's the biggest lesson learned, but what do you think what's the lesson that you've learned in terms of what the families have taught you about life? Um, what how have you grown from being a part of their experience? And yeah.
Oh, that's a question. I don't really think it's just one thing. I think coming from the Netherlands, I think it's in the States too. We come from a very like quick life. Everything goes fast. We do everything fast. And I learned in Guatemala from the families that you have to be patient. And and I think that I became very patient since I live here as well. Sometimes a little bit too patient because they are very like mañana. Ana. Sometimes it works on my nerves sometimes. But I think Guatemala and the families, they have taught me so much. You don't need a lot, to be very honest, to be happy in life. You don't need, for me, I don't need material stuff. I don't need luxury in my life. I'm just happy and very blessed that I'm living in this country and that I can do this job, that I can do what I love the most, that I can do it every single day and I still can live and eat. And yeah, I have absolutely the best job in the world and I will never ever change it in anything or something very to be happening in Guatemala. But yeah, because most of the families, they don't have a lot. We work, of course, with the poorest of the poorest, and we go, what I said, we do home visits, and sometimes they don't have a floor and they don't have even, they have one bed and they sleep in there with 4 or 5 people. And then you realize, holy, and they all smile and they love each other. And yeah, it puts you with both legs, or how do you say, with both feet on the ground. And you're very blessed and thankful for everything that you have.
Yeah. I love that perspective. I think that's so important. You mentioned also that Tess Unlimited is, now registered in the United States. So what are some ways that, like, our listeners can help this beautiful and wonderful cause? What can we do, to support or help you all get funding?
Yeah, so we are always in need of donations, of course, because we help normally 1,100 to 1,200 kids a year. So it's a lot. In the United States, there is right now an organization registered. It's called Cleft Care International, and they actually only support us right now. Yeah, every single donation that is made through Cleft Care International will be going to Tess Unlimited in Guatemala. And if people want to have any information about it, you can always send me a message on Instagram, Tess Unlimited Guatemala, and I will send you all the information how to do so. And we also have PayPal giving, which is also possible to donate.
You mentioned something about, just like the awareness, that has to take place, and I think that our podcast or this podcast is my intention is to spread awareness about the cleft journey. But also, I feel like, in the United States, we are very privileged, right, to be able to have surgery so early that a lot of times people don't feel like that it could happen to them, or they feel like, or it's just it's not even a thought, right? Like when they become pregnant. And I think that people need, and especially like they need to know to this. Obviously at the beginning we shared they only had one doctor, right? And so that's amazing and it is beautiful. And I think that the work that you are doing, the work that we are doing is creating that footprint, that global footprint about cleft care. And it's critical and it's important because I always tell people cleft doesn't discriminate. It can happen to you, it can happen to me, it can happen to anyone.
Very
And
true.
so
Very
that's
true.
so important.
Me, I really enjoyed it and very honored that you asked me to come. So, yeah, thank you so
Yeah, thank you. Thank you all for listening to the Our Forever Smiles Cleft Mom Diaries and Support podcast. Be sure to subscribe and submit a review of the podcast wherever you listen. I hope that you've enjoyed this audio experience. Maybe you cried a little, laughed a little, but more importantly, I hope that you feel a little piece of reassurance and even joy in your journey. Talk to you next week.